Salbutamol. Salbutamol, known as Albuterol in the US, is a short-acting beta-2-adrenergic receptor agonist. It is the gold standard rescue medication for the rapid relief of bronchospasm. The rescue inhaler mystery. A 19-year-old college student with asthma suddenly develops severe breathlessness while climbing stairs. He can barely complete a sentence. Loud wheezing fills the room and his oxygen level begins to fall. A blue inhaler is handed to him. Within minutes, his chest opens up, his wheeze subsides, and he can breathe normally again. How can one inhaled drug reverse life-threatening bronchospasm within minutes? Why is it called a rescue inhaler? The answer is salbutamol, the prototype short-acting beta-2 agonist. Mechanism of action. Its primary action is beta-2 receptor stimulation. This stimulates Adenylate cyclase, leading to an increase in cyclic AMP. Elevated cyclic AMP relaxes bronchial smooth muscle, producing rapid bronchodilation, which is why salbutamol provides quick relief during acute bronchospasm. Salbutamol also causes mast cell inhibition, reducing the release of bronchoconstrictor mediators such as histamine, while improving mucociliary clearance, helping keep the airways open. Finally, at higher doses, salbutamol activates the sodium-potassium pump, driving potassium into cells. This explains both its role as an adjunct in treating hyperkalemia and the risk of hypokalemia with repeated or high-dose therapy. Adverse effects. The most common side effect is tremor, which occurs due to skeletal muscle beta-2 stimulation and is usually mild and transient. Another important adverse effect is tachycardia and palpitations. Although salbutamol is selective for beta-2 receptors, cardiac beta-1 spillover at higher doses can increase the heart rate, and reflex tachycardia due to peripheral vasodilation may also contribute. Salbutamol can also cause hypokalemia by activating the sodium-potassium pump, resulting in an intracellular shift of potassium. Some patients also experience nervousness and headache due to mild CNS stimulation, and muscle cramps have also been reported. Clinical uses. Its most important indication is bronchial asthma, where it is the drug of choice for acute relief. Because it acts rapidly to produce bronchodilation, it is widely used as the classic rescue inhaler during an acute asthma attack. Salbutamol is also effective in COPD, where it relieves acute bronchospasm and improves airflow during episodes of worsening breathlessness. Another important use is hyperkalemia, where it is given as adjunct therapy. By stimulating the sodium-potassium pump, it shifts potassium into cells, helping to lower serum potassium levels while definitive treatment is initiated. Finally, salbutamol has been used for tocolysis, where it relaxes uterine smooth muscle and delays premature labor. However, because of its cardiovascular adverse effects and the availability of safer alternatives, it is less commonly used in current practice. Key takeaways. Salbutamol is a selective beta-2 agonist that produces rapid bronchodilation by increasing cyclic AMP in bronchial smooth muscle. Clinically, it is the rescue inhaler of choice for acute asthma and for relieving acute bronchospasm in COPD. The key side effects to remember are tremor, tachycardia, and hypokalemia, especially with higher doses. Finally, don't forget its important bonus uses. As an adjunct in hyperkalemia, where it shifts potassium into cells, and in tocolysis to delay premature labor, although this indication is less common today.